Hi, everyone. My name is Dr. Jobson, and I'm a board certified nephrologist. In other words, a kidney doctor. Welcome to Spill the Beans, where we talk about all things kidneys unfiltered. What we're about to discuss is general education, not medical advice. Numbers and targets are individual. Your clinician has the final word. Our kidneys can lose up to 60% of their function before we feel a single thing. So that wait and see is the worst possible strategy. The good news, we don't have to guess. There's a simple two-number map that tells you exactly where you stand and whether we're in the green or we are heading for the red. Let me show you how to read it. First, how to assess our chronic kidney disease stages. What is G1 through G5 actually mean? Where microalbuminuria fits in? And how to read the heat map every kidney doctor uses. By the end, we'll be able to look at our own lab results and know our risk zones. So let's get into it. First, we are going to talk about the G stages, and this is the filtering speed. Let's take the first number, eGFR, estimated glomerular filtration rate, which is measured in milliliters per minute. A healthy young kidney runs around, let's say, 90 to 100 or higher. Okay, so G1 is an eGFR of 90 or above, meaning normal filtering. G2, 60 to 80, mildly reduced filtering speed. G3A, 45 to 59. And this is mild to moderate drop. This is where a lot of people are first diagnosed. They're sent to the kidney doctor. They come in, they say, Doc, I am not sure why I'm seeing a kidney doctor. I feel fine. I'm urinating fine. But this stage, stage 3A, is where most people are diagnosed. Stage 3B or G3B is a filtering speed of 30 to 44. This involves a moderate to severe decline in our kidney filtering speed. G4, 15 to 29, it's severely reduced. At this stage is where you and your care team start planning ahead. G5, less than 15. This is kidney failure. At this point, the discussions begin with around dialysis or kidney transplantation. If you notice, the jump from G5 back to G1, that's the entire range of kidney function on a single column. But function is only half the story. Now, there's an important catch here. G1 and G2 only count as kidney disease if there's also a sign of kidney damage. And many people may ask, Doc, what are the signs of kidney damage, right? First, if you had a urine test and they checked for microalbumin and that is present, meaning protein spilling in the urine, that is a sign of kidney damage. Other signs include if you had any form of imaging, like an ultrasound of the kidney, CAT scan of the kidney, MRI of your kidneys, and they showed abnormal findings, like, for example, discrepancies in the kidney size. One is big and one is shrunken, or both are shrunken, or the cortex, which is the outer layer of the kidney, that is thin. That means the filter systems that are in this location are damaged. Other structural damages include presence of scarring on the kidney, like through a biopsy, and if there presence of cyst. On their own, G1 and G2, a slightly lower number can also be normal aging, and that is if there is no marker of kidney damage. So oftentimes I say to patients that similar to our eyesight or hearing, as we age, our kidneys age. And that decline, we can see it's usually slow and steady, and lowering of the eGFR over years. But if there's no sign of kidney damage, then we can closely attribute it to normal aging. Okay, so we're going to talk about the A stages and microalbuminuria. That is the second number, albuminuria, protein in or urine. So albumin is a big protein that healthy kidneys keep in your blood. When the filter gets damaged, albumin starts slipping through. The more that it leaks, the more damage. Here we can see the categories. A1, which means that albumin levels in our urine are less than 30 milligrams per gram. It's normal. The filters are holding. A2, 30 to 300 milligrams per gram. This is what is known as microalbuminuria. This is the one where this is small amounts of protein, so small your urine looks completely normal. You will never notice it. The only way to catch it is through testing. Here is why it matters. Microalbuminuria is often the very first sign that anything is wrong. Frequently, it is detected before your eGFR has dropped at all. It's the smoke detector going off before we actually see the fire. Microalbuminuria, the earliest warning sign and the most reversible. It is also the stage where you have the most leverage. This means through tightening our blood sugar control, meaning getting our hemoglobin A1C, which is a snapshot of our blood sugar levels over a 90-day period. The goal is to be less than 7%. Getting our blood pressure control. This is through incorporating strategies to lower blood pressures, working with our clinician team, your nutrition, lifestyle changes. If we're at risk of sleep apnea, to get it screened. If we are diagnosed with it, we should get it treated. Incorporating kidney protective measures, including medicines. And at this point, we talk about advocacy. You can say to your clinician team, if I'm at risk of kidney disease, what are certain medications that can be used to protect my kidneys from worsening kidney function and delaying progression of same? Improving protein spillage if there's any. And this is particular to your personal characteristics and your risk factors. So you need to speak with your clinician team. And last but not least, there is stage A3, and this is where you can have higher than 300 milligrams per gram, and it's called macroalbuminuria. It is heavy leakage of protein in your urine, and it means you're at higher risk. Through treatment, adequate treatment, particularly when you're at stage A2, you can actually slow it down, stop it, or even pull it back so it improves. Let's put them all together. Here we can see the CKD or chronic kidney disease heat map. So now we know we have two axes, the filtering speed going down the side, G1 to G5, protein leak across the top, A1 to A3. Cross them and you get the grid kidney specialists actually use. This is often known as the KDIGO heat map. It is color-coded like a traffic system. Green is low risk. Your filter is fast and tight. Yellow, moderately increased risk. Orange, high risk. Red, very high risk. The top left, where's the green? This is the best case. Bottom right, deep red, signifies kidney failure with a heavy leak. Here's the part that surprises people. Let's look across any single row. We're going to use G1, the same eGFR, which is greater than 90. And as you can see, from green to yellow to orange, as you move across from A1 to A2 to A3, your filter number didn't change at all, but your risk went up. This is exactly why we do not rely on eGFR alone. The amount of protein leakage or spilling in our urine moves us across the map. Okay, so why does microalbuminuria matter, or A2? Where does it sit and what to do? Let's find column A2. Here it is on the map. Even at a normal eGFR, as we had shown, G1 at the top, a little bit of protein bumps you out of the green into the yellow zone. That is the map telling you, act now, while it's cheap and easy. See it early, act early. So what do you do if you're found in the yellow or orange zone? Okay, the playbook is the same four pillars we had already discussed or came across on this channel. First, blood sugar control. So if you're diabetic or at risk of diabetes, or some people may say, I'm a pre-diabetic, this means that you need to get your blood sugar under control, tightening your hemoglobin A1C, meaning how ensuring that you're not having these blood sugar spikes. Because as you recall, these high sugar spikes are like sandpaper going through our tiniest blood vessels in our kidneys, and they cause the kidneys to scar. So we have to limit the amount of blood sugar spikes and keeping our blood sugar normal. Blood pressure control, that's generally under 130/80. And this is through different strategies, as I said before, speaking with your care team, incorporating lifestyle changes that are sustainable, screening for other causes of high blood pressure and getting them treated. And we will expound on this in upcoming videos over a 2 to 3 week phase where I'm going to talk about hypertension. So stay with us. Okay, and then incorporating kidney protective medications. There are different classes. Newer classes are what they call the SGLT2 inhibitors. These medications help to lower the pressure within the filter system and protect them from leakage. And again, you're going to speak with your clinician team, your care team, your nephrologist, your primary care team about your specific characteristics, your risk factors to see if you're appropriate to be use these medications. And last but definitely not least, screening, right? Screening is important. This is where advocacy comes in. We ask about our eGFR, or kidney filter speed, and our UACR, or urine albumin to creatinine ratio, or microalbumin levels. And you ask for it or get it done at least 1 to 2 times a year so you can catch any movement on the map. If you are at a higher risk zone, oftentimes this is done even more frequently, more than 2 times a year. Okay, so how to use the heat map, right? And here we're going to look. First, you find your eGFR, the G stage, as we spoke. Here you see from G1 to G5. Then you go across to find your urine microalbumin level. This is through the urine test. You'll get those checks done, and you will look at what place you will find yourself and cross the row and column. Your color zone will show your risk. And the simple goal is to stay in the green or actually try to climb back towards it. And this is through working with your clinician team and through lifestyle changes to prevent, delay, worsening of kidney disease. Okay, so if you are living with diabetes or high blood pressure, or you are at risk of chronic kidney disease, do me one favor this week. Ask for your eGFR and your UACR, urine albumin to creatinine ratio. Not one, both. Ask for both of them. So you ask how well your kidneys filtering speed is and how much protein is leaking in your kidneys in the form of albumin. Last, but definitely not least, let's save this CKD heat map. You can find it on my platforms, or you can actually find it on the internet. Save it. I encourage you to speak with a loved one and people across our communities about chronic kidney disease. If you or a loved one is at risk of chronic kidney disease or has been formally diagnosed for chronic kidney disease, here are tools that you can utilize to promote kidney disease prevention, raise awareness about it, because the goal is for each one of us to reach one of us and to teach one of us. And finally, don't forget to spare the beans.